What do you would like to correct? First of all, the upper lip. What do you think? Eyebrow enlarging a little bit the cheeks. Yes, it's a little bit evaporated. She's still young, but in all cases, it's the structure of the face. We're making it a little bit this way, a little bit freaky. And what else? Eyebrows are good. Lip and the cheeks, I suppose. And we can combine it both with the superficial treatment, with the intermediate treatment, with the therapeutic products. Okay. So let's put anesthetic cream. I just want to ask Victor, what solutions do we have now? Her natural structure is low eyebrows. It will be very good. It will give more fresh appearance, and probably to inject the upper lip and to treat superficially the upper layers of dermis with NCTF, because she has some scars, spots post-acne. It will help to make the structure of her skin more homogeneous. And in all the cases, it will both rejuvenate, rebalance her skin. So we'll put EMLA for about 15 minutes and we'll begin the treatment. Usually, I prefer to begin from the upper layers to the deeper layers, from up to down. But in the case of putting EMLA, probably we'll begin with fillers, and after that we'll continue with the superficial treatment. Okay, and we have one more patient that will correct her cheek a little bit. Her cheek, the form of her cheeks, it's flat, so we'll make it a little bit prominent. It will help to make her appearance more pretty, more fresh. We'll both correct her upper lip, and we'll think about the nose, both. So we'll decide. The preparations you receive in the box, that it's very comfortable. To each vial you have completed needles. First of all, a thick needle to take off the solution easily and quickly, 16G. It's very rare needle, very comfortable and quickly. 30 gauge needle and 32 gauge needle are short, 4 millimeters long for nappage. So you can work with it very comfortable, and you can begin working quickly. But a lot of times I used to inject NCTF with 32 gauge needle everywhere, all over the face. I use non-completed needles, 32 longs, 12 millimeters long. It easily injected, and you don't have wasted solution, and it's less traumatic for the patient, less painful, so it can be done. You can take it easily from the vial. It's 3 milliliters you receive in one vial. If we treat just face without neck and décolleté, it's enough 1 milliliter and a half. 3 milliliters, it's enough for the face, neck, décolleté, and sometimes even to the back of the hands. So it's a very effective procedure you receive. I'll use both Exochet 3 to treat her lips and nasolabial folds. So we can prepare it from the beginning. Here it is, sterile package, and open it quickly. Very comfortable syringe. And once more, I'll inject it with thinner needles, then the complected 130 gauche. I use it a lot in my practice. First of all, the most superficial level of treatment, superficial technique. Using this technique, we can treat superficially at the level of epidermis and connect both basal membrane. We can treat this level. There are thin fibers of collagen included in basal membrane, and it's very important to reach this level with our preparations. You must lie the needle on the surface of the skin, and here are the most superficial injections. You will be able to see that all this solution is totally absorbed by the skin during about some minutes, not more than 5 minutes. Our teachers like this technique a lot and use it always. Both Philippe Petit and Michel Torchman always show it, and I both use it. Almost no. You will see somewhere. It means that I go through basal membrane where it will be bleeding a little bit, and totally there are some places. Here it is, small drops. Yes. So we are very superficially, but all the preparation is absorbed totally because of the pores that we are making with the needle in the epidermis, and all the preparation is reaching the basal membrane, and we are treating really superficially. The light is not so good here, that's why you don't see it very well. And you see microcirculation, a little bit redness. It means it begins to work. Stimulation of the skin. This technique can be used even on the upper lid of the eye. Very light. Don't be afraid. It will be very easily. Don't be afraid, darling. Very light feelings, but she is more afraid, I'm sure. You see, there is no blood even. Yes, it's very good for fine wrinkles. And the dermis here is very thin, So this technique is very useful here. Sometimes, if it's more comfortable to you, you can do this way. It's 32, yeah.